Hi, winners. Hope you're doing good. So, all set to start the proceedings. And if you're hearing, okay, if you're watching this video, I hope uh, your plan to start your preparation towards anything, okay, that can be NEET or INICET or INBD or any sort of international license exam, okay, or anything like you want to upgrade yourself in dentistry. I hope you clicked on this video. So you're ready to set some new goals, okay, for your updated version of yourself in dentistry, okay, right? So we'll try to go deep into a few aspects, and I thought of doing it in uh, 3 to 4 episodes, okay, because long back I used to have a habit of taking it a single stretch, uh, 2 hours, 2.5 hours, but I know that the present generation cannot cope up to 2.5 hour session. Okay, so we thought of doing it in 3 to 4 episodes, and this is the first part. Okay, right. So I hope you're hope you know about me. I'm Dr. Srikanth, the founder and the director of MDS CONQUER groups, and yeah, you are the 11th batch, so we are almost done with the 10 years. Okay, right. So we are almost done with the 10 years, and you are the 11th batch students of MDS CONQUER. And I hope you can see few of your seniors. Uh, Main motto is a few of them are interns. Like, okay, right. So interns, they have grabbed the seat in the first attempt. Few are repeaters, and I hope like most of you are on the screen are your seniors, Telangana, Andhra state toppers. Okay, and few of them are all India toppers too. Okay, right. Uh, so I'll try to go deep. Okay, and I hope like few of you, again, few of you. Okay, so these are the people from INBD Conquer who has recently entered into uh, DDS by clearing INBD, followed by clearing the bench test. Okay, so I hope like few of yours are your seniors. Okay, and yeah, again, few of your seniors were in the best colleges of the country with a very good stipend. Okay, right. I still remember um, there were like 4 to 5, I think, like exclusively from MDS Conquer. There are 4 to 5 students from one batch of GDC Kadapa. Okay, uh, who are in the same central government college. Okay, sounds very good. Okay, it's not that easy to be a part of that, but yeah, a few of your seniors has made it possible. Okay, it's very great. Uh, I hope they are having the better version of dentistry over there, and I hope you can do it. Okay, you can also do it. Okay, so you keep your targets properly, and I hope like these things, okay, these great things in your dental life can be achieved according to me, because I have been seeing most of your seniors, 5 6 years, 10 years seniors also from the college, from your colleges, settled down well as of now. They're doing very good in dentistry. Okay, so right. So first of all, big congratulations to each and every one of you to reach at this particular point. I hope like few of your undergraduates who has not done with the final year also may be watching this video, but that's what I'm telling. Like, this video will redirect you to the best version of you. Okay, so like whatever college you are, maybe whatever state you are, maybe which background you are, maybe like, so we have a predetermined mindset that these things will decide our career. Background, where you are coming from, which college you are coming from, which state you are coming from, in state, whether you belongs to a town, whether you belongs to a city. Like, you see, the dentistry in Hyderabad is slightly different from dentistry in a town nearby. Like, for example, you take Nalgonda, the dentistry from Nalgonda will be different from the dentistry that is being practiced in Hyderabad. Like, you take nearby country like Singapore is there, or you take Malaysia. So whatever they are practicing is slightly different from whatever we are practicing. Like, few of your friends or seniors may be in USA. Like, as I said, like I've shown you, Uma is there, and all these are in dental practice. Now they're doing DDS. So I think like 2 or 3 days back, I was having a word with Uma. She's from Vishnu Dental College. Okay, right. And whatever practice of whatever exposure she's having in the dental school is slightly different. I'm not telling it's totally different, yes, but updated version of dentistry is being practiced in such areas. So dentistry is not same everywhere, but goals can be same. Okay, if you want to dream something, there is no barrier. I am from this college, I am from this state, I am from this background. No such barriers are there. Okay, so you can break the barriers and you can achieve something if you plan things properly under proper guidance. Okay, so you want to go to USA, you want to practice it, you want to update yourself, yes, proper guidance, yeah, definitely required. A person who has a better knowledge has to guide you, yeah, that is purely secondary. But you should have that predetermined mindset that you want to achieve something uh, in dentistry, right? So big congratulations for each and every one of you for coming to this point. That can be an intern who has recently entered finishing the final year, yes, it's a big achievement. Or a housewife after a break of 5 or 6 years want to bounce back and restart the preparation, yes, of course, it's a great achievement. Okay, so whatever it is, congratulations. As I said, Conquer Group is having India's largest microscopic dental hospital. And of course, MDS CONQUER, we have INBD CONQUER, and we have a high-end microscopic training academy in the city of Hyderabad. Okay, so now welcome all of you to updated version of yourself, an updated version of dentistry. And in this particular 3 or 4 episodes, I'll be addressing something which most of us don't know at an undergraduate level. Okay, means what is the market, what is happening there, what is having demand. Okay, what to be like, what are the things, what are the colleges. Okay, so what are the government colleges, what are their stipends, how many seats are there, am I eligible for that, what is the mode of counseling, everything you should make a note, because most of us are unaware of this. We are not known, like most of the things whatever I am discussing are unknown, and that are not being highlighted by most of the social media dentists also. Like nowadays you have so much of social media activity, right? Influencers are there, but I don't see, like, most of the influencers are not teaching something which is unknown, they're teaching something which is known. Okay, keeping that aside, so now the biggest question for most of you after clicking this video is what to be done now. Okay, I'm telling in a broad sense from an entire dentistry point of view. So after my 10 years of teaching, guiding the students, interacting with the students, because in this last 10 years, uh, I was interacting with many students in their colleges, personally in the offline, personally on phone and everything. Like, so I was in very close touch with the mindset of the student. So there is lots of drift in the mindset of generation. Means 10 years is a generation. My first batch to the 11th batch is a decade. So you see there is a lots of difference in the mindset of individuals, both in the negative way as well as in the positive way. So keeping all that in mind, so what to be done now? If you're asking me about dentistry, okay, so after this 10 years exposed to more than 14,000 to 15,000 registered students, so what I can tell, dentistry is choice. So whatever you want to be in dentistry, okay, whatever you want to be in a dentistry is smartly your choice. Means you want to get settled down well, it's your choice. Or you want to do a simple practice at your town level or a village level. I still have few of my friends who are doing a practice at a town level with just BDS. That is their choice. So that is their choice. Okay, because it was already 12 to 13 years done. We were passed out of the BDS. And similarly, there are few of my friends who are working in Malaysia. It's their choice. Few of my friends are working in Saudi. It's their choice. UAE, it's their choice. And like 8 to 10 people are settled in USA. It's their choice. Few of us have open clinics. Few of us are doing academic work. It's completely their choice. So after 10 years into the dentistry, so whatever I feel like, dentistry is completely your choice. You want to be successful in dentistry, yes, it can be done. Or you want to fall on other side of the coin, yes, it is completely your wish. And similarly, if you are asking me internship, because few interns may be watching this, okay, so what is internship in dentistry? Choice, again choice. You want to enjoy, your choice. Okay, I have my group of friends who always are in a trans position to enjoy internship. Yes, it is their choice. On other side, you want to work hard, analyze yourself, do something which is beneficial for your future, it is your choice. So internship is again your choice. Post internship is again your choice. Still remember, there were two or three girls in the offline center who are from my batch, who are from 2K7, 2K8 batches. passed out in 2012, 2013, 14, restarted the preparation after 10 years. They have 2 kids, they have clinics, and they are working so hard. They're working so hard, and their approach towards the dentistry now is totally different. And I know a few of these girls, 5, 6 years back, at the time they're getting married, they are my students. And again, after 5, 6 years, having 2 kids, done with all the family stuff, they restarted the preparation. They're doing very good. They're working so hard, and hopefully they are going to enter into GDCs or at least like a good private college seat in the next 3 or 4 months. And if you ask me about this particular woman, about this mother of 2 kids, it is completely their choice. They have taken that initiation. Yes, we need to bounce back in the life. So dentistry, internship, post internship, or you're working in clinic, suddenly you got motivated by the people around you. Suddenly you see something, you got motivated, you want to do this, you want to do that, or you had a big breakup, or you were like so depressed in your life. Okay, getting separated from the people and all this nonsense will definitely give you a power of emotion to bounce back in your life. Yes, it is bouncing back in your life. Bouncing back in dentistry is completely rarely your choice. So it is every step in dentistry or in life, according to me. After seeing so many individuals at so many levels, I strongly recommend, I strongly believe that it is the individual choice to bounce back in the life. Prove that you are more than what you imagine. Okay, so what to be done now? It is completely identifying your choice, getting motivated by the people around you, being positive in this journey, and keeping proper goals with a proper guidance, under the guidance of a mentor at all the levels. It doesn't mean like I see interns, you get a college day, you're completely out of box because you don't remember your goals. Enjoying in a college day is a temporary thing. Cracking an entrance, settling down in settling down well, cracking or entering into endo or entering into OS or entering into ortho, your dream department, or moving to USA to practice dentistry is dream. A college day or a sports day or a college event is a temporary thing which escapes out, and all these tags, whatever I am talking, are permanent things. So a permanent goal should not disturb a temporary activity. I see interns, they simply get deviated, simply get disturbed. Someone is coming, Achalo, let's go for a tour. Yeah, 1 month is done. So how can you leave your goals? How can you leave your dreams? How can you live your life to enjoy 2 or 3 days? So choice with a commitment is required here. Okay, right? So interns who are keeping their choices, goals clear and working towards their dreams, okay, seriously, are making great achievements in the life. I'm very happy for most of your seniors who has done this, and I hope like most of you are on track to repeat this or recap this again and again. Okay, so the first thing is what to be done now. Keep your goals clear, keep your choices clear, and you should give 100% of your commitment to achieve those goals, to achieve their dreams. It is very simple. It's very simple. Means I'm indirectly telling you do your job. You do your job. Once you are doing your job, okay, all the things will fall aside. So next one is most of us should explore dentistry at all the levels. Like someone is watching it after finishing their MDS, my recommendation is same, exploring the dentistry. A BDS graduate want to practice in their hometown, exploring the dentistry. You want to go to Australia, you want to go to USA, you want to go to UK, you want to go to any sort of Middle East or Gulf countries, my answer is exploring the dentistry at every level. Now within your college, you have this explorer limitations. Like college level, yes, we have some limitations. Once you come out of the college, at a town level, you have some limitations. City level, you have a limitation. So make sure you always should have a habit in dentistry that you have to learn new things, new concepts. So you are inclined to clinical dentistry, you should learn new clinical things. Like you try to question yourself. Okay, right? Now the laser dentistry is ruling. Laser dentistry is really doing good. Okay, so now my question is, how many of you are aware of proper laser dentistry? I'm not talking about those composite curing lasers, okay, or devices. I'm talking about laser dentistry. So at a BDS level, I feel like none of the colleges are more inclined to allow you to practice the laser dentistry. Okay, so similarly, and few private colleges, let it be government colleges, even in post graduation, also the exposure to the laser dentistry is very minimalistic. like what are doing very good. Okay, like you see, microscopic dentistry is doing good. Okay, right? Digital dentistry is doing good. We don't have a proper chapter on digital dentistry, proper chapter on microscopic dentistry, proper chapter, like, so there are lots of modifications to be done in the DCI curriculum, according to me, because there should be a chapter or a subject that should be added. Survival, how a dentist can survive, how you should, uh, life lessoning thoughts has to be taught at the college level. Okay, so you should be, like, before coming out into the market, before coming out into the society from the college. Okay, right, then you can easily control what is happening around you. Okay, within the college you are protected, outside the college you are not protected. Okay, so dentistry is always exploring, always updating at any level. Third year to final year, just I'm giving a suggestion, third year to final year or final year to internship, you have lots of updated work. Your work is become better. You're doing a tough cases, you're doing new cases, you're going to assist the PGs, learn something over there. So it is a level of exploring at a college level. That's what I'm telling. Even at a college level, we have a level of exploring. So at different levels, we have a different level of exploring. So make sure at any level, I want you to explore the dentistry, know what are the deep roots of dentistry, how the dentistry is going at different levels. For example, you're traveling to a different country for a vacation. You try to check out within the limitations or within your time limit. Okay, you try to go to nearby dental clinic. Okay, try to observe the things over there. Okay, try to observe the things over there, what they're doing, what is their practice, how much they're making, what are the costs, what are the materials they're using. So this is what called as exploring the dentistry at all the levels. Okay, right? So what do you know, okay, in dentistry is very limited at a college level. Even I, for example, even I know 10 to 20% of dentistry after this 10 years into MDS CONQUER anything. Like, so dentistry is always upgrading. Whatever you know, maybe 10 or 20% is whatever you have to know, you have to explore is more and more, and it is upgrading day by day. Okay, so what you have to do is keep your goals, like, sir, as of now, within my knowledge, within my commitment, within my exposure, I feel like oral surgery is good for me, or endo is, I'm interested towards endo, I like prosthetic work, I like ortho smiles, or I want to make more money, so I'm choosing this particular department, I want to get settled down like this. So keep some goals now with whatever knowledge you have. Okay, and start the journey towards your goal, like how a Google map is going to direct you to your goal, to your destination. Okay, now in the middle of this particular journey, okay, with MDS CONQUER, and my motto is not only teach you, guide you and all this, my motto is always try my best to update you, upgrade you. Okay, so that is the reason why in this 2026 batch, okay, what we have done is we have added two to three online upgraded courses. Okay, so some clinical dentistry, laser dentistry upgraded courses, which you can access through online and attend that workshop, get some knowledge, like what is happening in the market, how the market is there. Okay, how much the patients are paying us, how much the clinicians are paying for a consultant. Okay, right? And exploring, that's what I'm telling, like what is the type of dentist that is being done in USA. Such a workshops we are trying to conduct for this 2026 batch, both offline as well as online. The main motto is we know everything, but we don't know what to do once we are out into the society. Okay, and most of us, what we are doing is like we are just trying to copy paste the things around us. Okay, so once you, like, this is what happening, like BDS people, once they passed out, they come out, they start working in a clinic, and they just copy paste whatever that is happening in the clinic. This is not right way of dentistry. This is not right way. Okay, so a clinician is deciding what you have to do, or you are being deciding that what you should do by watching one or two clinicians around you, making the life simple. Okay, like, for example, my suggestion, you want to get settled down in Kadapa, or you want to get settled down in Kurnool or Vishakhapatnam, you come to Hyderabad, you come to Mumbai, you come to Pune, you come to Delhi, do some practice, observe what is happening. Because compared to this list of places whatever I have mentioned, yes, metropolitan city will definitely have a better dentist, and you need to choose a better dental clinic if you really want to copy paste something from them. Okay, so most of us are missing this logic. Okay, So like we always need to upgrade. Okay, you have a route map now. This is your destiny and this is your starting point. So once you're halfway into your destiny, you may get to know, okay, right, this is okay. I thought, oh, this particular department is going to be so beautiful for me, but I feel like now at this point, because I'm getting like influenced by my mentors, or I attended a workshop and now I got a scope about this particular department. I don't know at a UG level. For example, at a UG level in ortho, what we do a straight wire, we do an Adams class, we do a finger class. That is our level. Okay, right? But once you are exploring on a day by day basis, like halfway into the preparation because of some workshop or something which is out of box, okay, you got to know, okay, yes, ortho is doing good, right? I feel like ortho can be done. Like now you can change your destination. Nothing wrong. Okay, you keep on upgrading your destination, upgrading yourself. That's what I'm telling you. Exploring dentistry will give you new thoughts, new ideas. That is more important in this journey. In this journey, preparing an entrance, cracking an entrance, getting a rank, you have lots of seats available in India. If not government, if not central, you have normal government seats. If not normal government, you have state government seats. If not state, you have A category, you have B category, you have C category, you have deemed college. You have lots of nonsense that is available. It's not about the nonsense. It is about you in the script is more important. What you are thinking, what you want to be, how you want to upgrade yourself. These are the main questions that we need to address during this journey. And I'm not against to the people who are taking a break or enjoying the internship, okay, or want to explore more, want to move out, run here and there 2 years or 3 years, learn something about life, learn something about dentistry. Nothing wrong, nothing wrong at all. Or you can pack, like, oh, time is more important, right? The most important factor, okay, is time. Okay, time is always most important factor. It's not money. At one point in the life, the time is the most important factor. I hope most of you have watched the most trending uh, like most trending web series like Money Heist. You have seen Money Heist. The mode of Money Heist, the main goal of Money Heist is not money. Is not money. Why it's not money? Because there is no money there. In Money Heist, there is no money. They have to print the money. So to print the money, what they require, they don't require money. They require time. So they always try in the Money Heist. It moves on a theme that's stealing the time. So time is more important in life after a particular point. The money comes second. Okay, so keeping all these things in aside, like you want to explore in internship, learn this, that, move to here, move to there. Yes, it's fine. It's fine, not an issue. But you want to pack yourself, do this, do that, okay, manage this and that, by which you are saving your time, by which you are saving your life. The story would be different. And I know 80% of the people who are watching this video are women in dentistry, for sure, because I move to all the colleges. I see 80-85% of women, exclusively women colleges, like you say majority women, all are women. Okay, you see, like you go to most of the colleges, I see like 10 or 15 boys, maximum 80-85 are girls. Okay, so, and second thing, when I'm talking specifically about women in most of the zones of India, they don't have this freedom, except like 5 or 10 percentage of women, their parents may be more liberal to give that freedom. But women, the waiting period is very, very less. What is this waiting period? Waiting period in my sense is like you're done with your internship. Okay, right? You're out into the market. Okay, you're done with your internship, you came into the market. Okay, you have a lap of 2 to 3 years given by your parents, few parents, not all the parents. Then you need to enter into your family, your new family, that is getting married. Okay, this waiting period for men will be slightly more, not more in the sense like not 10 years. Okay, the waiting period for the men will be around 5+ years. For the women will be 2 to 3 years. Sometimes few parents may. So in this waiting period of 2 to 3 years, okay, you need to get settled down with your work, or else again you have to take break after the marriage and you have to come back again. Okay, so this is where I see most of the women are disturbed in their career. Most of the parents, they give 2 to 3 years. In this 2 to 3 years, or in this 1 to 2 year, if you enter into PG, if you enter into post graduation, this 2 to 3 years or 1 to 2 years can be prolonged to 3 to 4 years. At least they'll wait up to up till you complete your PG, giving respect. Okay, so oh no, my daughter is doing a post-graduation. She's in the second year or now about to finish the final year. So they gave that space, extra space. The 2 to 3 years or 1 to 2 years waiting period will be now converted to 3 to 4 or sometimes 4 to 5. So that you can get settled down with your tags, you can get settled down with whatever work you do, and then you enter into your personal life. Okay, so this is a personal suggestion that is specially given for the girls, okay, who are watching this video. So make sure, I want you to be very, very clear in your goals and everything, because I have seen people, I mean, it's not about wasting the time or something, but I'm seeing people who are feeling bad for the calls, whatever they have taken. Okay, so internship, yes, you can enjoy, but that's what I'm telling. I want to keep a question mark. Okay, do you really require? Yes. If not required, you want to run fast, you know the situations in the family and everything, so we should respect the family too, so please do plan accordingly. Okay, right? So that's all, those are the main things which I feel like I need to address. Okay, if something I missed, maybe I'll be updating all this stuff in the next episode. So a goal without a plan is just a wish. So we have goals. So now I told you what to be done. First thing, keep some goals, keep some dreams. Now I want you to plan a proper plan with a proper guidance towards your dream. Okay, so now planning is important. So now the next step, I'll be talking about planning. And this is a very common thing that we regularly see in dentistry, right? People around you, I don't want to blame anyone or don't want to tag anyone. Let it be your teachers, let it be your seniors, let it be your PGs around you. All these people, they have a word, dentistry is saturated, dentistry. Yes, dentistry is saturated, not good dentistry. Dentistry is saturated. I agree that the dentistry is saturated. Okay, at all the levels. You see my hometown, dentistry is saturated. Even in my hometown, there is a requirement of a good dentist. Dentistry is saturated at every level. I still remember I was telling to the offline students, okay, so once I take the left to enter the offline line, which is almost like a 500-600 meters, there were like 4 to 5 clinics. And 4 to 5 clinics they were there. And I told, like, if you have some issue randomly, just for your what is happening to know what is happening in dentistry, you just try to be a patient. Go to these clinics. Just like a survey. 5 clinics are there. Most of the clinics, they don't take any OP fees. Okay, few of them, they may take an OP fees of 200 to 300. Okay, let's base 1,000 rupees. I give 1,000 rupees. Okay, chalo, go these 5 clinics, and being a dentist, you try to rate these 5 clinics. I told this. This is last year we have done this. Okay, and I told to rate this. I was sitting with the student because the student was completely bored, frustrated. Dentistry is saturated. I can't do this. I can't do that. I thought of opening a clinic in my hometown. There were 5 clinics opened in this year. So feeling so bad. So we made this, and I was sitting with that particular individual, and we are talking. And I told, what is the rating that you want to give to these clinics which are nearby, whatever you have listed? She said, like, out of these 5 clinics, sir, in 3 clinics, there were no dentists. There were no dentists at all. Okay, because that is a second or a third branch of a particular dentist. They told me to wait for half an hour, that the dentist is going to come. He's on the way and something. Even after waiting for half an hour, in 2 of these clinics out of these 3 clinics, okay, the dentist has not arrived within half an hour. Okay. So no, the point is, I'm not blaming anyone. I'm telling good dentistry has a life. Okay, so dentistry is saturated at ground level. So you have different levels of dentistry. One is ground level of dentistry. Next one is after the ground level, there is high-end dentistry, premium dentistry, refined dentistry. Refined dentist in the sense, endodontist doing a root canal therapy is a refined dentistry. Means they are refinedly addressing the specialization cases. Like you see, file separation. BDS people can also do a root canal therapy. Appreciated. Okay, can be done. But if you're talking about a repair of a perforation or talking about file separation, I think no one can do unless they have some microscope, some add-ons to them. That is called as refined dentistry. Means clinics who are having microscope. So they can do refined dentistry. They can do micro dentistry with a normal naked eye. No, I can also repair. I can also do this. No, without microscope, you cannot see. Then how can you do? So the question is, ground level of dentistry is saturated. I'm talking about laser dentistry. How many clinics around you, how many dentists around you know a proper laser dentistry? So dentistry at a ground level may be saturated. There is lots of competition at a ground level dentistry, but not at the upper levels. Okay. Similarly, good dentistry is not saturated. Great dentistry is not saturated. A basic dentistry is saturated. Okay, right? So whenever someone is telling you this and that, uh, my suggestion is you don't take that granted into consideration. Okay, right? So first of all, you should research or you should do the ground level practice about dentistry, about your dentistry. You have to do ground level practice. You cannot simply take a suggestion from any of your senior or any of teacher who may be frustrated, or any of PG. Like for example, you talk with PG. PGs will have lots of stress oriented work. They have patients, they have to manage HOD, they have lots of things to be done. Like suddenly you go sit with the PG and say, sir, how is the dentistry? Hey, just now he has got lots of scoldings from HOD or guide. Now you are sitting in front of them and talking them, sir, how is the department, what to be done? What they are going to tell you, they're going to show all their frustration on you. Okay, that you should not be taken into considerations. Like even if you want to talk with someone, okay, make sure you ask them, request them, are you free in this evening? Okay, shall we meet in the library or anywhere, having a cup of coffee in a nice place? You have to talk these things, not in the rush, in the department, in the middle of cases, frustrated. File separation was done, you are going and asking, sir, is endo good? Shall I do endo? How is our college? Is our college good for endo? And all these things are going to make things more I mean, like you talk with this with lots of hope, but they are not going to reciprocate in the same situation, because considering their situation, you should not take calls. Okay, so this is one important thing I'm frequently encountering with lots of students telling that PGs are frustrated. And yes, of course, their work is different. Their work is overloaded. They are overloaded with work, means they are doing great work. When someone doesn't have a time, it means they're doing their work properly. So that is the reason why they don't have time. So we should respect that. So what should I do? Okay, what should I do? The first formula from my side, what should I do? The biggest formula is you should trust yourself. That's what I'm telling. Don't blindly start throwing the things on others. Okay, so you should work and you should trust yourself in this, and the trust is directly proportional to consistency and inversely proportional to time. Simple. Okay, the more you do the work repeatedly, for example, you're doing extractions, you constantly doing 2 to 3 extractions per day, and what you're going to build, you're going to build trust on you. Okay, yes, I can do it. Similarly, once you're doing more extractions in a lesser time, again lesser time, you build more trust on yourself. So it's very, very important. Trust is directly proportional to consistency and time. So this is how the future of your dentistry is going to work. So first of all, you should have trust on yourself in achieving this, in making this possible. And with that, it is linked to your consistency work and with your time. Means, yes, I want to get a good rank. Yes, I want to get settled down. In how much time? You should mention the time also. In within 1 year, I want to get a good rank. Within 5 years, I want to get settled down. So you are mentioning the timeline. So timeline is very, very important. Here I have two great examples. Okay, and I strongly believe that most of us, including me, we never thought we are going to become a dentist at a school level or uh, at a college level, 11th and 12th and all these things. Okay, because of some mishaps or some XYZ factors, we failed in an entrance exam and now we are here. Okay, right? And I strongly believe that few of you, at least few of you, are short by 2 to 3 or 3 to 4 or 4 to 5 questions, which made us to sit here. I still remember I was short by 2 or 3 MCQs. I was short by 2 or 3 MCQs. The 2 or 3 MCQs has made me to become a dentist here. Okay, so now my consent is, okay, respect the time, respect everything, because we are already failed at one level to be here. So now I don't want you to fail again. Okay, let it be anything, because it's a competition, right? Let it be an entrance exam, it's a competition. Or you talk about DDS, so everything has a competition. I still remember, I hope you remember this uh, semi-finals between India and New Zealand, where Dhoni was shot by very short distance. You see, the very, very short distance. And we lost a World Cup. That is secondary. The individual also has like if he would have crossed this little bit of milestone, we would have seen a different Dhoni. Okay, right? So I think it is not basically a luck. Okay, it costs more sometimes. Okay, that's what I'm telling you. 2 or 3 MCQs at that entrance examination, we would become an MBBS doctors at this position. And similarly, in the same series, the final is between New Zealand and England, and the final match is a draw, and followed by the super over is also a draw. Super over is also a draw. Okay, so Gaftul was short by few more inches, and England has lifted the World Cup. New Zealand has not yet received a World Cup till the date. ODI. Okay, right? So sometimes that's what I'm telling, like few decisions or few things, okay, so will totally change our view towards the life. So that is the reason why once you enter into this competition, because you are in a country where the population stands highest, and economy wise we are standing, as of now we are standing in third, fourth position, slightly third and fourth, and the government is so strong that they are planning to push us to 1 or 2 in the next couple of years. So we are standing good in economy, we're standing good in the population. So the consent here is you should be outstanding to survive in this market, to survive in this growing market, growing population. You should be outstanding. So you should be refined, you should be polished. Okay, so you should be perfect for everything. Okay, so that is the reason why I want everyone to be serious from now. Okay, so what after BDS is the biggest question. Okay, so most of us may have an average, a decent a decent um, a decent past or a bad past. I'm talking about dentistry. Okay, and so my consent is, let's leave about your past. I want you guys to focus on the present. Let's focus on the present. Okay, plan the present well, dream the present well. Okay, okay, to grab your future. So future is in your hands. When the future can be in your hands, if you focus in the present, plan properly, dream properly, keep your goals properly, plan your goals properly, and keep the focus properly in the present, then you can clear your future. Okay, so very, very important thing I want you to this is very important thing to be addressed. So jumping into the major topic of today's, that is what after BDS. Okay, so my classification after BDS, analyzing so many students, I have prepared this particular classification. What after BDS for an Indian graduate can be split into: one is domestic, staying in India, getting settled down in India, getting settled down your hometown, getting settled down in cities, metropolitan cities, or you may get married to any one of the boy or a girl, then basing upon that you need to move within the country. These are the domestic plans. And the second one is moving any place is going to be an international. International means not your dream destinations. Your dream destinations are different. Like last year I got a call from one of the student from Andhra Pradesh, one of the colleges. Okay, uh, like you love a particular place. For example, you love Kenya, wildlife and everything. Yes, that's a dream destination. You want to go there, you travel there, do some trip and come back. Okay, you cannot settle down as a dentist over there. Okay, international dentistry means, okay, international dentistry means, so now I'm talking about India. India is a domestic. So international dentistry means where dentistry is better than India, better than India. One second thing, where opportunities are more, where opportunities are more. Okay, okay, where the lifestyle is better, where the lifestyle is better than India. So such a countries you have to choose. That is the first criteria, right? You got it right. You see, people are talking about going to USA, people are talking about going to Australia, New Zealand, UK. Okay, why? Dentistry is better, opportunities slightly vary from country to country basing upon the situation of the country, lifestyle is better. So that is the reason why people are going there. You never see people okay, I'm going to Nepal to be a dentist. No, why? Dentistry is better in India than Nepal. Opportunities, I'm not very sure. Lifestyle in India is better than Nepal. So people don't, I mean, like I see a few of you, you don't have a proper idea over this. So people will come and ask me, sir, how should I like that particular place. I want to go. I want to go to Maldives. I want to go to this Sri Lanka. No, that is your dream destination. Like you want to go to, you want to do international dentistry. Yes, these are the main things that you have to address. Better dentistry, better opportunities, and better lifestyle. Of course, safety and all these plays very, very important role if you are planning to choose international. Basing upon that, there are few international countries which has better opportunities, good opportunities than India. Okay, right. So that is about the first classification, domestic, international. So now I have a criteria how to choose. Like I told you, right? How to choose a country is different. Whether to go India, whether to go international. Okay, whether to go India, whether to do the same in India, whether to go international will be decided by factors. Okay, so factor number one. The factor number one is time. How much time you're going to take to settle down in a particular country as a dentist, or in a particular country before you start making money to clear your loans or XYZ. That is factor number one. Time is factor number one. I told you, right? Always time is very important. Then comes the money. Second one is money, right? So second one is money. How much money you spend? They are like, again, last year I got a call from one of the students from Narayana Dental College. Still remember the girl, almost a topper, very good student, very high percentage. Planning, decided to go to Singapore or Malaysia. I don't exactly remember. She decided to do MDS in Malaysia or Singapore. I don't exactly remember. She was calling me, sir, what is the process and everything? No, Singapore is very expensive. You can do MDS. No, sir, I have a good percentage. I'm topper. Even if you are topper, you need to pay. Okay. I don't exactly remember the numbers. Like you want to do MDS in Singapore, that will definitely cost some 3 to 4 crores. Very expensive to do MDS. And she don't know that. She was dreaming to go to Singapore to do an MDS, assuming that she's a topper. She will be getting a scholarship. That's what I'm telling. Like you should be very, very, very clear. Once you want to move to abroad, any country, any license exam, any country, you need to spend money. So how much money you have to spend, how much time it is going to take. Then the third important thing is, if not this, it's not mandatory, right? It's not mandatory that you should get this exactly. If not this, what is your plan B? All the students who are planning to go to abroad, you should have a plan B. In fact, you should have a plan C. If not this, what next? If not this, what next? Okay. The fourth factor is the most important factor. Okay. Who is going to provide you time? Who is going to provide you money? Who is going to help you if you change your plan A to plan B, plan B to plan C is, yes, right, perfectly right. Okay. Parents. Okay. Parents. So whenever you are deciding to go to international, to any country, make sure all these factors are there. Make sure you sit with your mentor. Make sure you ask the parents to sit with your mentor. An online call, an offline call. Now you have to plan for international. Randomly, my senior went, I'm going to do. My junior is there. I'll be doing. My batchmates are going. No, these are the factors to be considered. Okay. Like for example, if I'm considering myself, okay, I'm from a lower middle class. Okay, when I was there at a BDS level. No, I have time. Yes. My parents are okay. Yes, I have plan A, B, C, but I don't have money. So all these factors are very, very important to choose an international project, to choose an international, to become an international dentist, to be considered. Okay, right? So please do make sure that you have all these factors before you jump in. And that's the important thing. Once you are fixed towards the international, to a particular country, to a particular purpose, so you need to check both the positive side as well as the negative side. Okay, so list out all the positives, negatives of your particular goal. Okay, right? Then I told you to add your plan A, plan B, and everything properly. So for example, if I'm talking about the negative sides, okay, if I'm talking about the negative sides of your particular goal, so list out all the negatives, and find out a proper solution how to overcome this negativity. Like for example, money is becoming an issue. For example, you're going to a country where you need to spend money on a monthly wise. Okay, you need to spend more money on a monthly wise Now you find out a solution. Yes, okay, fine. I'll try to do some part times to pay some of my basics. Or like for example, you're going to ADC, you fail the exam, you need to retake the exam. Again, retaking the exam, you need to pay money. So you need to find an alternative to get your financial source also for that particular condition. Sometimes you require more time. So every goal will have both the positive side as well as the negative side. So I strongly recommend you to list out all the negatives and find a good solution, alternative solution, how to overcome it. Okay, so that is very, very important aspect to be noted, and everything has to be properly organized, written in the notes. Everything has to be on papers. Okay, it's not like my senior is there, I'll go. No, this has to be organized properly so that you can reach your destiny fast and within time, so that you can settle down well. Because it is in India, yeah, your parents are there to support you, friends are there to support you, family is there to support you, India itself is there to support you. But once you're moving a different country, who has to support you is only you. Maybe we will give you that financial support or mental support, but we cannot come at all the times. So you need to plan everything properly, and I strongly recommend students who are planning international to write down everything. Okay, to write down everything. Right. So now I'll be talking first in this episode, I'll be talking first about the domestic. Okay, that is in India. And the most important thing to settle down India, particularly if you don't have proper financial backups and everything, as a dentist, and I strongly recommend MDS is the first option to be discussed, and MDS is the first option to be addressed, and I personally, MDS is the best option. Okay, so how can we do MDS? Okay, so long back the stories are different. Okay, so I think Andhra and Telangana, Jammu and Kashmir are not eligible to All India till 2016. 2017 is the first year where the eligibility has started. Okay, so long back we don't have that eligibility also. Rest of the states are having the eligibility, but these states are not having the eligibility. So keeping that aside, so doing an MDS has some particular gateways. Okay, right? So particular gateways are there. So we are going to discuss about those gateways. So there are two exams with which you have to do MDS, because MDS, to do the MDS, at least you have to qualify the exam. Okay, right? So gateway 1 is Neet MDS examination, and gateway 2 is INICET MDS. So Neet MDS exam is going to have similar, like around like 96 to 97% of entire seats in the country of MDS will be through this examination. And approximately as of now, we have 6,500 to 6,800. I don't know the exact number. Okay, DCI website also. The update was done like I think one and a half year back. So the number was around like 6,500 to 6,008. Around like 7,000 seats are there, MDS seats, which will be filled through Neet MDS examination. That includes government colleges, all government colleges, except AIIMS, PGI, and GPMR. Except AIIMS, PG, and GPMR, all government college seats are included here. Okay, next comes all state private colleges, all deemed colleges. Every college is included in this except AIIMS, PGI, GPMR. Okay, right? So that turns around 6,500 to 6,800 seats. And the next comes is INICET MDS. INICET Neet MDS is done once in a year, particularly around February and March of that year. Previously, long back, it is used to be done in December. Now it is February, March. Because of COVID, there is a drift in the schedule. And coming to INICET will be done twice a year. One session of INICET will be in the November. The second session of INICET will be in the May. Seats around 25 here, 35 here, turns to 60 seats. 60 seats will be filled by INICET. And 6,500 to 7,000 seats will be filled by the NEET. And it's mandatory, even if you're financially strong, even if you're son of an HOD, you have to qualify the exam to enter into MDS. You want to buy a seat also, you have to qualify. Okay, right? Right. So that's all about like all the seats all the colleges in the country will be filled by NEET MDS except AIIMS, PGI and GPMER. Okay, that is the first important thing I want to address. The next, how many government GDCs, government seats are there per year in India? Okay, how many government seats are there per India in India is 550 to 600. Out of 6,000, roughly 6,500 seats, let's make it as a figure of 600, means 10% of seats in the country are from government dental colleges. What is an advantage of government dental college seat is no need to pay fees, no fees, okay, no fee. Minimum caution deposits will be there, that turns around like 5,000 or something, okay, that is not considered, no fees. Every month you will get stipend. You'll get stipend every month. You'll get stipend every month. Just for an information shake, I'm telling. They, in India, the highest stipend is around 1,16,000 per month. Okay, per month. The few colleges which pay 1 lakh. Let's consider it as 1 lakh. 1 lakh per month. So per year it is 12 lakhs. And 3 years of PG, 36 lakhs. You will get a stipend. There are few colleges, that's what I'm telling. Like I have added few of your seniors were from that particular college, KGMC, Maulana, BHU, Rohtak, and all these colleges have a stipend of more than 80,000, 1 lakh per month. Okay. For example, if you're talking about the private colleges, okay, right? Because I'll be preparing a state-wise private colleges basing upon the request, please do drop. You want me to discuss about your state college, how many seats are there, what is the stipend, everything, please drop me in the comment box, so that in the upcoming episodes, or I'll try to prepare a separate video. For example, I'm telling, for example, if it is Andhra Pradesh, you have two GDCs, GDC Vijayawada and GDC Kadapa. And if you talk about stipends, you talk with me about stipend, okay. So first year stipend was 60K per month. Second year is around like 61 or 62K. Third year it is 64 to 65K. So these are the stipends as of now in Andhra. Telangana, a little bit, like 3 or 5,000 more, around like 65 to 70 the stipends were. Okay, right? So that's what, like, you can calculate it. 60 per month turns around like 7.2 per year, turns around like 22 lakhs. You'll be getting stipend for 3 years. Okay, right? So that is an advantage of getting into government dental college. That's what I'm telling. And here, very important thing, I want to talk about the cutoffs, rough cutoffs, not exact cutoffs. Okay, exact cutoffs. Okay, so what is this? For example, if you want to get into GDC, it can be a clinical, it can be a non-clinical. Non-clinical means on other side, like oral path, oral medicine, radiology, community comes under non-clinicals according to me. Okay, right? Because they don't do any extensive procedures in the patient's oral cavity. Okay, for example, if it is an open category, clinical seat, government dental college at an all India level, is going to be, the cutoff is going to be 300. Non-clinical OC, the cutoff will be around like 400, 450 sometimes. Okay, right? And if you're talking about OBC or EWS, a little bit more. OBC may have 350, EWS may have 450 for clinicals, and for non-clinicals, it may have 400 or 450. It will reach up to 500 or 600. For an SC category, the clinicals can come up to 1500 to 1800 good clinicals, and a non-clinicals can extend up to 2000, sometimes 2500 plus also. If it is ST, the clinicals will come up to 2000, 2500 sometimes. Okay, and a non-clinicals can extend up to 3000, 3200. These are rough numbers. Okay, I don't want to, I'm just giving a scope, like you belongs to a category. This is the scope. You should know about this. Like before you enter into this journey, you should know about this. And one more important thing I want to address is about the counseling patterns. Okay, right. So I told you that's all India counseling. One is all India counseling will be there. Second one is state counseling. For example, your particular college is state college, state government college. I'm talking about government. All India All India counseling is for government college seats plus deemed college seats. So my focus is on government college seats. For example, your state is having a particular government college. That's what my next question is. How many seats, how many GDC seats are there per year in your state? Now I'll be talking about, because in the previous video I talked about Karnataka. Okay, so in this video I'll be talking about Andhra, for example. Okay, you want me to prepare a separate video on the number of seats and the counseling patterns of your particular state? Do drop me in the comment box. I'll try to address as quick as possible. For example, if you take AP is having two government dental colleges. Government college number one is Vijayawada GDC. So Vijayawada GDC is having 3 seats in 8 departments. So the total number of GDC seats in Vijayawada are 8 into 3, 24 seats are there. And these 8 into 3, 24 seats will be occupied by AU people only, with 1 or 1.5 seat to a non-localite. That is SVU. Okay, but it is priority will be given more to the localates. What is the localates? Okay, so all colleges of Andhra except Narayana Dental College, Kadapa GDC, Pullareddy Dental College, and CKS. So these 4 colleges will be coming under SVU reason. So rest all colleges, like you take SSDC Srikakulam, followed by Geethams, Anits, Lenora, GSL, Amalapuram Vishnu, and St. Joseph, SNDC, Sibar, CARE, and GDC Vijayawada. All these fall under AU category, and only students from these colleges are eligible to take these seats. Okay, right? So that's what I'm telling. Like, you have 24 seats in Vijayawada. And what is this All India Counseling? All India Counseling, there is something called as All India 50% seats. Means in every government college, 50% of seats has to be given to All India. 50% of seats has to be given to All India. That is called as All India pool. Means all the states, all the colleges are going to give 50-50 seats. That is a All India pool for which you are eligible. Okay, you can take seat in any college. For example, you want to enter into like your dream college is GDC Bangalore, or GDC Pondicherry, or GDC Goa, or GDC Shimla. You can enter which seats, that 50% seats only. For example, if you are asking me to split Vijayawada GDC has 3 seats for each department. So 1 year they are going to give 2 seats. The next year they are going to give 1 seat. So totally 50%, right? So that is how. Then it's not 24 half, 12. No, it's not like. Okay, 1 year they are going to give. One year they are going to give 8 into 2, 16 seats. The next year they are going to give you 8 into 1, 24 seats. Lucky. Who are lucky? You are lucky. Okay, 2026 NEET aspirants who are watching this video. So state pool, number of seats in the state pool of AU region in 2026, you will be having 16 seats in the state. The 16 seats will be occupied by the list of colleges I told you. Your seniors who are going to give 2025 exam, they will have only 8 seats. Your batch is going to have 16. Your juniors are going to have 8 again. Okay, right? So 2026 exam, number of seats through state pool from AU region will be 16. So this is the biggest motivation. Means 16 of you who are started the preparation now can enter into the state pool seats, government seats, and stipend I already told you 65 first year, 60 first year, 61 second year, and 64 third year. And probably in the next couple of years, the stipend may again increase. Now I'm talking about GDC Kadapa. Okay, right? So GDC Kadapa is having 1, 2, 3, 4, 5, 6, 7. So it is having 7 into 3, 21. Prosto, it's having only 2 seats. So Prosto 2, totally you have 23 seats. And these 23 seats, which are in the state pool, which will be state pool, will be occupied by colleges of Narayana Dental College, Kadapa GDC, Tirupati, and Pullareddy Dental College, right? And Pullareddy has less number of intake. All these are having 100 intakes. Pullareddy is only having 50 intakes. Look, you can consider 3.5 colleges. Okay, now you're lucky enough that you are having 23 seats. Okay, for example, if I'm talking about 2026 NEET examination, how many seats will be there in the state pool of SVU region of Andhra Pradesh, okay, because it varies from state to state. SVU region of Andhra Pradesh is 2 into 7, 14 plus 1. So you guys in 2026 examination counseling will be having 15 seats, which will be occupied by these 3.5 colleges. Okay, so 15 by 3.5 turns to 4 to 5 GDC seats for every college. You're preparing seriously, you every college, like if you 3.5 colleges, you distribute these seats equally, what is going to happen? You're going to get 5 GDCs for each college from state pool. Apart from the state pool, you guys are eligible to all India pool also. If you get a great ranks, you're eligible to all India pool. Okay, state you will have 15 seats. All India, if you grab at least 10 from these 3.5 colleges, totally you can grab 25 seats by 3.5. That turns around 7 to 8 GDCs from each college if you distribute equally. Okay, right. I hope this is very, very clear, right? I want to address this. Okay, other state people, Karnataka, already a video is there. Okay, I'll try to drop that particular video session in the description part of this video. And other states, if you want, please do let me know in the comment box, so that I'll prepare a video at this particular like 5 or 10 minutes video on how the counselings and everything happens, so that that will help you. Okay, right. So I told you there are 2 rounds of INICET and 1 round of NEET. So totally 3 exams will decide your things in your MDS. Okay, the first exam that you guys are eligible is INICET November 2024. INICET November 2025. Okay, right. So INICET November 2025. So first of all, the number of seats, I told you, right? The number of seats are around like 20 to 25 seats are there. Number of questions are 200. Time duration is 3 hours. Negative marking is -1/3. And here they have a timeline based exam. Timeline based blocks will be there. So you have 50 questions in each block, which has to be done in 45 minutes. So once the first 50 questions in 45 minutes done, that block will be closed and the next block will be open. So it is basically divided into 4 parts. So 4 into 50 is 200 questions, and 4 into 45 minutes is 180 minutes. And I hope it's very, very clear. The result will be announced in percentile. 60 to 70% of questions are from clinicals with slight alteration. Like we check out every 5 years, 4 question papers will be on clinicals, 60 to 70%. Like 1 bouncer may come. Okay, and you may have a decent number of diagram based questions also, which we'll be discussing once we start the preparation. You'll get exposure to all this content, so that you'll have a better idea. But as of now, you check out the number of seats. Exam will be in November 1st or 2nd week, most probably in 2025. The next exam is March 2026. I told you, right? All seats, all GDCs, all private colleges, all deemed colleges, even selection of Army Dental Corps, except GDCs, except, we have already discussed, except AIIMS, PGI, and GPMR fall under this category. So I think NB has released a notification that they are going to change the pattern of exam, but as of now, we don't have any official update. So once the official update is ready, I'll try to drop an updated video on the YouTube, on Instagram, that you can watch. Okay, right? If not, as of now, it is having 240 questions with 180 minutes and -1 for the negative marking. Basically, for every right answer, you have +4 score. For every wrong answer, you have -1 score. So it is basically 240 into 4. Any update, any notification is out regarding NEET 2025 with modification of pattern of examination, I'll definitely prepare a video as quick as possible and drop the video to you. Okay, right? I hope this is very, very clear. So that is about March NEET examination. Then comes the next one is, I told you, right? So once your November INICET 2025 is done, the next exam that you're eligible after NEET is going to be INICET May 2026. Slightly, you'll have more number of seats. Okay, here it includes PGI, GPMR, and AIIMS, where November INICET is going to include only AIIMS seats. Same, the pattern is same again, same. Okay. Sometimes the paper may be dynamic, having some SR-ship questions, some medical questions, medical repeats of aims and everything that we'll be discussing once we go deep into the preparation. These should not be included in the superficial talks. Okay, so I'm not going to discuss much about those things in this particular episode. I told you, right? Luckily, NBE authority has given a blueprint related to the NEET examination. I told you NEET is for 240 questions, and each question is going to carry +4 and -1. Wrong answer is -1, right answer is +4. And they have given a blueprint that includes 14 questions for each subject. So this blueprint is very, very important as of now. If there's any modification, within a couple of days, I'll try to update that particular modification. Right. So the most important thing I want to make a note is general anatomy with general embryo and histo is 14. So embryo and histology are also important. Make sure you're reading from any source. Make sure embryo histology has to be done, because I have seen sources where they ignore this. Physiology 7 and biochemistry 7 together 14. Dental anatomy, dental histology 7, 7, 14. Micro and path 7, 7, 14. Dental pharmacology and normal pharmacology 7, 7, 14. Dental materials 14. Medicine 14. Surgery 14. Oral path and oral microbiology together 14. Oral medicine 7. Radiology 7. Total 14. Pedo 14. Ortho 14. Perio 14. Prosto 14. Endo 7 and Con 7 together 14. Oral surgery 14 and public health dentistry 14. Total 240 into 4 is your final score. Yeah. So I told you, right? INICET, the result will be in the form of percentile. Correction, mode of correction is different. NEET, your result will be in the form of score. Okay. And the website of MDS CONQUER give every exam result. Okay. Every exam result, both in the form of percentile and both in the form of final score, to compare your scores for INICET or NEET. Okay, right. So for MDS CONQUER students specifically, okay, I want you to follow this particular thing. Okay, your power play books. Okay, your power play books plus your worksheets. So now this year 2026, you no need to prepare notes from the smart videos of MDS CONQUER. Okay, a partially prepared notes will be given in the form of worksheets. What is this partially prepared notes? Partially prepared notes is not entire notes. It is 80% of notes. The leftover 20% of unfilled notes has to be filled by you while you're watching a particular video class. You'll be having lots of video classes. So what you have to do is you have to keep your worksheets in front of you when you're watching the video class. 80% of notes is already there. Like for example, Elite's classification is there. 1, 2, 3, 5, 6, 8 classifications will be there. So 4 and 9 will be missing. So 4 and 9 you have to write down after watching the video. Okay, so half 80% notes will be there. 20% of notes you have to fill, by which I'm considering this as a workbook or a worksheet. Okay, along with the power play books. And I want you to from the day one, I want you to get exposed. Like once you're done with a particular subject, make sure you try to analyze what are the questions which are given in the last couple of years from that particular subject in a particular year. So that analysis can be done on the group. So from 2017 to 2024, questions which are given both in NEET, INICET along with medical repeats has to be done once you're done with a particular subject. That's very, very important. And of course, now a new feature that is added for 2026 is question bank. Okay, you have a question bank. So once you're done with a particular topic, you can go jump into the question bank and try to solve the question bank. Okay, a different pattern. You have a video. I'll try to add that question bank description video also. How to use the question bank effectively also in the description part. Please do check it. So we always update the videos. Okay, right? Latest concepts or modifications or guidelines. So dental guidelines will get upgraded every 2 to 3 years, and you see like classifications, few classifications they get upgraded. Latest perio classification is different. Latest pulp and periapical classification is different. Whatever classifications you do are slightly different. What are the latest classifications? And exams will definitely ask questions on those latest classifications, which has to be addressed. So all you have latest videos on the website, and last minute revision, quick revision videos will be there. You have mock exams, you have textbook reading, whatnot, you have everything. And make sure because you need to keep some add-on notes, it's better you keep some add-on notes. We'll have live classes and everything. As we go deep into this, we'll get a better analysis over each and every aspect of whatever you're doing with MDS Conquer. Okay, so this is all about your preparation of NEET and INICET, particularly the most important domestic plan. In the next episode, I'll be discussing about Army Dental Corps. Okay, and I'll be discussing about the plans, okay, the plans that are available in MDS Conquer, because we have two plans that are available. So I'll try to split and discuss those two plans, because it's a very frequently asked question by the student: which plan is good? What is the difference between both the plans? What is the extra add-on and everything? So I'll try to, in the next episode, I'll try to cover two major things. One is how to start the preparation, okay, and one more important domestic plan about Army Dental Corps, a little bit about government dental jobs available in the country, okay, right? Two, about the plans of MDS Conquer, difference between Plan A and Plan Pro, which is good and everything. Three, okay, so these three aspects, maybe like it will take 45 minutes. So we'll be coming with the next episode within 1 or 2 days, not with a huge gap, within 1 or 2 days. Okay, right? So see you. People who want to be part of MDS Conquer, or who want to talk with me, analyze everything. So please do. I mean, yeah, my number, the team number will be there in the description part. You can check and drop a message to the team. Tell your concerns, so that the team is going to, if required, the team is going to arrange a call, so that a one-to-one call can be done, and it may help you. Okay. And the next important thing that I want to address is, okay, within the time limitation, within my time limitations, my considerations, classes, everything. Every year in the last 10 years, I am trying my best to approach, interact, meet most of you in your college premises. If it is possible, yes, I'll definitely come. If it is not possible, yes, luckily, we are the next generation version, right? We have access, right? You can meet anyone, any person. You can talk on phone, WhatsApp, Instagram, lots of stuff are there. So it's nothing big deal that to meet us, to talk with us or anything. Okay, right? So as of now, I'm done with episode number 1. Episode number 2 will be uploaded within 2 days. Okay, and once it is uploaded, I'll try to upload. I'll try to update that in the description version also. Okay. As of now, signing off, Dr. Srikanth from Team MDS Conquer. Hope this video is useful, informative, and motivative to you. Okay. So please do like and share this to your friends, seniors, juniors, your batchmates, because maybe it may be useful for someone who are really having that great hunger to bounce back in our field, to achieve some heights in our field. And I'm always telling, upgrading, exploring are very, very important in our field to be successful. Great day. Take care. Bye bye.